Welcome to CPF Firewire, a podcast from California professional firefighters where we discuss a wide range of issues affecting firefighters, our unions, our families, and the communities we serve.
As you all know, January is Firefighter Cancer Awareness Month, and at CPF, the fight against firefighter cancer is one of our top priorities. And together, we can protect those that protect us. From our groundbreaking California Firefighter Cancer Prevention and Research Program to the tools like the Personal Exposure Reporting System and our partnership with one of our own brothers, a leading cancer researcher from Los Angeles County Fire Department, Captain Derek Irwin, CPF is advancing early detection and prevention strategies that save lives. We also have an ongoing partnership with Kaiser Permanente on cancer research and prevention, which includes the California Firefighter Health Study. As part of this partnership, I'm excited to speak with two guests today that will speak to this opportunity to participate in this cancer research if you're an active or retired California firefighter and a current member of Kaiser Permanente. This will also provide some practical strategies for firefighters to prevent cancer. So without getting too much further ahead, I want to introduce my two guests today. First will be Misha McKinney. Misha is an oncology nurse and a vice president of clinical programs at Kaiser Permanente. She also co-leads Kaiser Permanente's national cancer strategy. Misha, thank you for being on with us today.
Thank you for having me.
And then my second guest is Dr. Danielle Malache. She is an internal medicine physician and an expert in lifestyle-based medicine at Kaiser Permanente's Petaluma medical offices. So Dr. Malache, super excited to have you here with us today.
Thank you so much for having me.
Just real quick, you have a pretty special connection to the fire service. Would you mind sharing that with us?
Yes, so my father is a retired battalion deputy chief of San Francisco Fire Department, and he retired about 20 years ago. He is a cancer survivor, and so this topic is near and dear to me, having seen him go through what he went through and living the life as growing up with a fireman. And so I'm just pleased to be here to represent this topic, and he's, a great role model for me as well. And thank you. Yeah.
That's fantastic. I can tell you that San Francisco Firefighters Local 798, as far as firefighter unions and firefighters in this country, I believe are at the forefront of cancer prevention and wellness among firefighters. They have really been in the trenches in this field for the last almost 2 decades. So we're very blessed to work with San Francisco firefighters in this effort. So super cool connection with your father.
Thank you.
Misha, I'm going to go to you. Firefighters face a distinct health risk due to the nature of their work. Can you elaborate on some of the most or more significant health challenges that set firefighters apart from other professions, and then particularly regarding cancer risk and chronic conditions? What do you see more in the firefighter world?
Sure. Thank you so much, President Rice. So I've been an oncology nurse for over 20 years, and I have seen firsthand the consequences of the unique risks that firefighters face from on-the-job exposure. So we're talking about things like unusually high exposure to carcinogens, extreme heat, intense physical strain, and all of these really significantly elevate their risk for cancer, respiratory disease, and sudden cardiac events. So firefighters also experience disproportionate mental health challenges related to other professions as well. And for cancer, we really see things like bladder cancer, lymphomas at a much higher risk within the profession for firefighters than we do in other professions.
Is there anything that Kaiser Permanente is doing to address some of the specific health needs of firefighters?
Yes. So, Kaiser Permanente has been prioritizing prevention since we began as an organization in the 1930s. So we built our entire model on integrated prevention-focused medicine. So that means that we're incentivized to keep our members as healthy as possible. And I want to share this really important statistic with everyone, which is which really helps to show the power of the KP model in prevention. So Kaiser Permanente members are 20% less likely to die a premature death due to cancer compared to other people living in the same communities we serve. That is a really powerful number. And, when you think about how we make this happen, when I think about what it was like in New York State before I came to Kaiser Permanente, I can see a huge difference in how simple and easy it is to stay healthy. So, for example, when I would go to get my mammogram in New York State, my primary care doctor would print out a piece of paper and give it to me, and then I'd have to find someone who could do the mammogram and call them, schedule the appointment, remember to ask them to send the results to my doctor. And sometimes they'd remember and sometimes they wouldn't. And sometimes I'd forget to get the mammogram. So then I'd go back to my doctor the next year and they'd say, hey, we never received your mammogram. And it was either because someone forgot to send it or I forgot to do it. And fast forward to being at Kaiser Permanente, I can't encounter the health system without someone reminding me that I'm overdue for my mammogram. So this year it was my optician that said, hey, can I book that for you right now? And, I think making it that easy, once I get there, it's 15 minutes, everything's in the same building. I think there's a benefit in having everything, like your insurance, all of your clinical care, all in one place so that you're not having to get prior authorizations or go to multiple different places and have your medical records sent. So we make it easy to stay healthy. And I think that makes a huge difference. And we're also incentivized to do that. I think that these things are really important when you're a firefighter because you're working shifts and you don't want your healthcare to be a scavenger hunt on your day off. So, I'm really excited that Dr. Malache is here today to talk more about our primary care and lifestyle medicine programs and how they can support cancer prevention and really the overall health of firefighters. She's going to talk a little bit about some of the topics that she's going to talk about came from structured interviews that my team did with firefighters all across California. So we met with firefighters to find out what was most important to you when it comes to your health. And it probably won't surprise you to know that the top things that came up in our interviews were cancer, sleep, stress, and nutrition.
Misha, it's interesting that you brought up not just the testing pathway, but the reminders and the follow-up. Both my wife and I are Kaiser members, and I've lived and experienced it through the connection with our doctor, and then the reminders on colorectal screening, my wife with mammogram, and how regular that is. But even more than that, what I found helpful, and it speaks to kind of what you talked about in the experience, and it's something I never thought of or took for granted. It all goes to one place with one doctor who reads it, provides me with that backup and that follow-up. So that portion of no matter who, we're kind of talking about KP right here, but no matter who your physician is, the important part is the follow-up and the communication in between. So that's super important. This one's gonna be for both Misha, for you and Dr. Malache. I'm gonna go to Dr. Malache first, and my question is, what role does a personal doctor play in cancer prevention and early detection, and how can they spot early signs or chronic conditions or cancer in firefighters? So kind of looking at the role of our personal physician.
Yeah. So I do think that annual exams are important and to make sure you don't miss those exams. But for sure, early detection is so important for cancer prevention and or treating cancer if it's found early, because early detection saves lives. But I really encourage also at any moment in time when somebody has a symptom to not wait for just the annual physical exam, but to come with any concerning symptom, if it's a headache, stomach pain, cough, even joint pains. So we do have standard guidelines for cancer screening, but to be honest, that goes aside whenever a patient comes for a concerning symptom. the role for us is to make sure we don't miss anything, and we don't want to miss anything. So early detection and coming to the primary doctor as soon as a symptom is felt, and not to feel bad about that. I have patients come with all sorts of symptoms for their routine exams, and I will make sure the worst possible things aren't happening. And if everything's fine, then that's great, but still to continue follow up, and you don't have to wait for an annual. You can come anytime you want.
Misha, any follow up?
Yeah, I was smiling because when you were talking about early detection, last year I went in to have my annual physical and they checked my blood pressure and it was high. And so they brought out this big red stop sign and put it on my doctor's desk. Like there was no way that my doctor was going to miss it. Like, and I was like, oh gosh. But the good news is that as a result of that, I'm now going through the lifestyle medicine program under the direction of my primary care doctor, Dr. Joel Cobb, who is amazing. So he's helping me manage my rising cholesterol and my blood pressure before it becomes such an issue that I need medication. And so he's put me on a diet. It's called the DASH diet, dietary approaches to stop hypertension. And it's just this whole method that, helps to lower blood pressure, reduce cholesterol. And so now I'm reducing my long-term risk of heart disease and stroke and diabetes and certain cancers. So it's fantastic.
Something, and I'd love to hear both of your perspectives on this. As we're kind of looking and thinking about issues to discuss, I can tell you, I think this, what I want to get your perspective on, I think this fits almost all men across the board, and certainly firefighters. Do you run into, and how do you deal with it? How do you recognize it? We all have a tendency, if we're having a symptom or something happening, to minimize what that symptom is and to make it, I feel like if I can make it not seem that bad, it's probably not going to be that bad. How important is it for each of us to have that relationship with our doctor and the nursing staff too, to be open and upfront about what we're experiencing? And then if you guys could just kind of relate on some of the consequences if you minimize, signs or symptoms or don't suggest them. What do you see on your end as a nurse and then as a physician too?
So first off, I think healthy communication is super important, and creating an environment in the office space that creates trust and creates an easy way so that patients feel the most comfortable. For example, I have dim lights and music playing and a whiteboard that has all the lifestyle medicine tips there for patients to reflect on. And sometimes they'll say, oh, I need to work on number 1 or 5. And so creating a trusting environment is very important for patients to open up, even if it's the simplest of a symptom. And I find that does help make patients speak up about things that they might minimize. And so that's kind of to the first point. But the consequences of not speaking up could be nothing or it could be something. And so I think that, again, as a physician, really taking into account the history and running through everything head to toe on a physical exam. So just going through, do you have headaches? Do you have chest pain? Do you have shortness of breath, abdominal symptoms? And really tell me if it's just a minor symptom, because then I go down a little rabbit hole and then I ask questions more about one little symptom that they think is little could actually be something big. And I also tell them it's important to tell me the little things and to create that trusting relationship.
President Rice, I will share that, I mentioned, having this experience in oncology nursing and having the opportunity to speak with so many patients who have shared their stories with me, working on the head and neck unit and also on the breast surgical oncology unit. There were so many patients that said to me, I noticed that, I had this lump on my throat or on my breast, or I had this spot on my skin, but there was part of me that just really didn't want to know. And so I waited. And then I had other patients say to me, you know what, I noticed, and I mentioned it to my, my spouse or to my kids. And then they kept on me to follow up. So I would say if you notice something about yourself, grab an accountability partner, someone that's going to help you to make that next step, to take, to go to the doctor and make that appointment. I think when you have that accountability partner and someone there with you, it just makes it a lot easier.
As firefighters, we see this, we see it in the field, but I've also seen it with friends. And usually you'll see it around somebody who's had a cardiac event. Sometimes you'll see it around a cancer diagnosis. And it's the, I've kind of been having this chest pressure and this chest pain for the last 3 weeks. Or, I did notice blood in my stool like a month and a half ago, but I didn't do anything about it. What kind of a position does that put you in, Dr. Malache, as a treating physician? And how detrimental can that be to an outcome for a patient? If you're noticing something, say it.
Exactly. If you notice it, say it. Come prepared with a list of questions, too. That makes the office appointment go very smoothly and make sure we do take care of everything. But if a patient presents with chest pain, I will do complete workup. We do EKGs, treadmill stress tests, stress echocardiograms, and whatever is needed to actually diagnose coronary artery disease and get on the right treatment plan. The other thing with heart disease that's super important to rule out and to do labs for diabetes and cholesterol, markers of inflammation, and making sure those risk factors are also not present, as well as blood pressure. As far as rectal bleeding, at any time a patient presents with rectal bleeding, there are a series of questions we will ask, but if someone is presenting with rectal bleeding, they get a referral to gastroenterology for a colonoscopy and appropriate screening. Yeah.
If it's happening, say something about it. Don't wait, or don't wait for it to go away. I think that's kind of what I hear.
Yeah, and I also would say, too, that our physicians here at Kaiser, not everybody knows all the health risks of all the occupations, because there are many occupations with health risks. But I would say amongst my colleagues, whenever there is a presenting symptom that is concerning, we always want to make sure that we take care of whatever the worst case scenario could be before we just say, oh, everything's normal.
And Dr. Malache, can you kind of tell us about lifestyle medicine? And I think that might be kind of something new to most of us. And what can we expect there?
Yes. So lifestyle medicine is an evidence-based medical specialty that applies therapeutic lifestyle interventions to treat chronic disease and to prevent chronic disease, including cardiovascular health, diabetes, obesity, blood pressure, and cancer. And it's formulated and it entails 6 pillars of lifestyle medicine, we call it. And if you like, I can go through those now. The first is optimal nutrition, which is a plant-based diet or plant-strong diet, physical activity, restorative sleep, stress management, social connections, and avoidance of risky substances, specifically smoking and alcohol. And those are our 6 pillars.
If you replace the smoking and alcohol with a toxic environment, it's really hard for, firefighters, the physical exercise, the good diet. We all start out that way, but when you're at work and you started trying to eat at 5 o'clock and you're looking at a plate of food that's been sitting for 3 hours, it's those things that a lot of things I think we do that we remain pretty healthy. But there's some things that we can't change our work environment completely. We can safeguard ourselves from the risks. Stress is just going to be there. You can counsel and you can do the things to minimize. And the big one really for all of us is that sleep deprivation. I was talking to Misha a little bit about this, and I know this sounds kind of silly, but if you eat well, you rest well. Can doing those positive things help offset some of the negative risk factors that come with our lifestyle?
Yes, as best we can. So we know that firefighters face stressors compared to other occupations that are definitely more challenging in terms of the shift work and the hours and the chemical and the toxicity exposures. and applying the lifestyle behaviors as best we can when they're not working is the advice that we give in lifestyle medicine to help them have more control of their lives, to feel social connection, to do all these beautiful behaviors that hopefully can offset the risk factors of their work.
Awesome. I want to kind of jump over sleep deprivation and sleep disruption. I mean, that is just a common reality in the fire station. And, sometimes, you hear people say, I'll sleep when I'm dead, and a little bit of make light on it. But I'd like to talk about how important sleep and restful sleep is to our overall health, and how does that impact our cancer risks as firefighters. And Michelle, I'll start off with you.
Sure. This one kind of, it hits home, having worked night shift for more than 7 years. And I definitely can say that, drinking like a pot of coffee every 24 hours, and then once coming off duty, then just like trying to have a glass of wine to like be able to fall asleep after the pot of coffee. It's like, it just throws your body like so out of whack, because it's very difficult then to fall asleep. So, I think those disruptions, it's really hard to get back on track, but being able to have some sort of like sleep hygiene. And what I mean by that is like, making sure that you've got good strategies to be able to not have any light in your room when you are sleeping, and, making sure that you're not like on your phone when you are right before you fall asleep. Trying to avoid like the extremes of coffee and alcohol, like I did, and, having that sleep sanctuary. I used to have blackout curtains. I kept the temperature low in my room. This was like in the days of landline, but I would unplug my phone so that no one would like wake me up, because my gym used to call me and say, "Hey, do you want any new members?" Like at 11 a.m. when I had just fallen asleep. It was really used to make me mad. So I think, just communicating to family and friends, hey, like this is my time to restore, and I need this time to sleep, because sometimes I think family and friends, they don't understand what it's like to stay out for 24, 36 hours and what it means, and like how it feels. I used to feel like every cell in my body hurt. So I think, having that good, minimizing the substances, keeping like a good environment, and, talking to your friends and family and trying to keep those disruptions at bay are good things. But I'm sure that Dr. Malache's got good suggestions as well, and explain a little bit more about the like what's going on chemically in your body when all of this is taking place.
Sure. So quality sleep definitely helps improve cellular repair and our immune function. And I think that there's not a lot of awareness that there is so much going on while we're sleeping. And I think it's actually for me, it's the number one pillar, because if we don't sleep well, we don't have the bandwidth to exercise, to go socialize with people, to, do all these wonderful things and make good food choices and choices not to drink and smoke and whatnot. So, the disruptions of like the circadian rhythm. So circadian rhythm is very important. It's our internal clock, and it regulates DNA and gene expression and hormone production. So when we don't sleep well, we have accumulated damaged DNA, and we have dysregulated cell growth, and we have hormonal imbalances that all feed into cancer production or development of cancers. And then melatonin is also produced when we sleep. It's an antioxidant. It's very good for our health and for protecting cells and protecting against DNA damage. As well as when we sleep well, we prevent a lot of chronic inflammation that's associated with cancers. We have, when we sleep, also the immune system getting boosted, so to speak, and that we have this system of immunosurveillance where our body is surveying for damaged cells and cancer cells and malignancy and sort of fighting. And you might notice when you don't get a good night's sleep, even just one night, you feel unwell the next day. You can't think straight. You might start getting sick because it's like, it truly does. It's measurable by cytokines and interleukins and tumor necrosis factor and all these cellular mechanisms that are being researched and how sleep is affecting our immune system and hence risk for cancer. And then finally, insulin resistance is also linked into this because there's increased risk of insulin receptors being affected by sleep. And when you have increased glucose in your bloodstream, it can feed into cancer cells. And also there are certain cancers that actually have insulin receptors, and it can cause more cancer production, essentially. So all these things, so circadian rhythm, melatonin, inflammation, our immune system, insulin resistance, all ties together with sleep. And so I agree with everything Misha said about prioritizing sleep when you're off duty so that you sleep when you can. And telling family and friends, like, I need to just have my rest before I start running errands and going to do things, and just to have that downtime and creating the environment at home to create a peaceful, wonderful sleep environment best you can.
It really sounds like for most of us, because I think about my sleep habits and how bad they are, it really sounds to me like this is almost a whole other discussion on how important restful sleep is to our bodies at a cellular level to recuperate and heal. So I'm going to mark that one down. I think that's a discussion for another time, but a lot deeper. But we don't put enough importance on sleep.
Sure. Yeah.
Dr. Malachi, I'm going to stick with you for a second. Kind of goes right along with sleep, stress management. The job of being a firefighter can be extremely stressful. And how does stress relate to our cancer risks as firefighters?
So thank you, President. So for stress, first defining what it is, it's a state of mental and emotional strain resulting from adverse or demanding circumstances, whatever they might be. And chronic stress, just as I mentioned with sleep, suppresses the immunity over time. It increases inflammation. So I find with these things, there's this theme of the immune function and also inflammation in the body contributing to cancer risk. But there are, of course, tips to decrease stress when we're not working and we have a chance to, what I would say, decrease that sympathetic drive that occurs when we're fighting to the fire and waking up with the alarms going off and running and doing, trying to find what you love to do the best that you can when you're not working. So you have that downtime, whether it's meditation, yoga, nature, time with your family. Animals are even very healing. There's research on that. And all these things to decrease mental stress definitely plays a role with cancer prevention, and also patients who have cancer and their survivability and how well they do on treatments.
Misha, absolutely stress management. Add, if you have other insights, please add those. But let's talk about connectedness. After a firefighter shift ends, a lot of times we can bring that stress home. And how important is it, and maybe some tips on trying to separate the realities of the job with the reality of home and being connected at home. For a lot of us, it's hard to disconnect from work. It's just hard. You guys know that as nurses and RN and a physician, you know that too. And the importance of separating the two, putting one on hold, and then reconnecting with family, thoughts, tips, and how that really leads into our overall well-being. And I guess potentially, does it have a more positive effect on our risks for cancer?
I think in terms of social connection, firefighters are fortunate to have that community amongst themselves, but also, when you do go home, having that ability to be able to transition from work to home life in any profession that is extremely stressful, having that in the body, making sure to have that social connection, it impacts your hormones. And when I say hormones, I mean there are hormones in your body that impact inflammation. They impact your blood sugar. Every system in your body is impacted by your hormones. And so when you're able to have that social connection, there are certain like feel good hormones that are released that can like bring your blood pressure down and make you feel more calm and more connected. And also, some of those are like good examples. One is oxytocin. It's something that also happens with moms and babies when they're bonding, but you can have that with other humans. And it's like, it's such a great feeling to have that connection with others. And I think, when people have more social connections, what we see in the evidence is that you tend to get more physical activity, you have better nutrition, you use fewer risky substances. And to go back to what I said before, like you can have accountability partners in your health. Like you don't have to go it alone. You can have other people that are helping you in those healthy behaviors and making sure you're, eating the right things or saying, hey, let's go on a walk or let's go on a run together or, let's try this new meditation class together. So I think, firefighters can reconnect with their family and their friends. They can join support groups. They can sign up for activities and classes. One thing I want to mention on stress reduction and sleep, there is an app called Calm. So if you're a KP member, it is free to you, but anyone can really purchase Calm. It is absolutely fantastic. So you can use it for meditation. They have special meditations to help you fall asleep. They do sleep stories. So like think about, like when you were a little kid and, your parents or your grandma would read you a story and you'd fall asleep. It's the same thing. So, I'll use that even when I wake up in the middle of the night and my mind is racing 100 things. If I do that sleep story, I'm asleep before like the first 3 sentences. It's absolutely fantastic. So like those are other things that you can do to really help, with that stress reduction. But I think it's that social connection that reduces isolation. And, Dr. Malache, I'm wondering if you can like distinguish the difference between like isolation and being alone.
Yeah, good point. Because loneliness is actually described as a feeling, and social isolation is more of physically being alone and removed from a group. And so one could actually feel alone if they are in a group. Of course, that's not the goal when we try to engage with others that are supportive for your needs and support your well-being. And so that is definitely a difference. And then, of course, taking into account a message that we really believe in lifestyle medicine is how social connectedness does boost your immune system. There's research on that and how it affects the body and the mind and our behaviors that help us engage with others, help us to decrease inflammation, decrease stress hormones like cortisol, the feel-good chemicals like you mentioned, like serotonin and oxytocin, and it gives people, and there's research about this, a sense of safety, purpose, meaning, and resilience. And that's so important in moving forward when you feel broken down by work and exhausted and like you can't go another day. But when you have others to turn to, and if you have others that are going through the same thing, somehow you kind of make it work together and you build strong bonds. I will have to tell you, my father, to this day, all of his friends from the fire department, they get together and they go for their coffee and their San Francisco walks all the time. We have parties together every year at the holidays. And it is such this bond that I have never seen in other groups, actually. And so I'm so glad for that. And other things that one can do to create the bonds or to get away from work with a social connection. Like my father actually created a painting company. And besides doing fireman work, he would, with his friend at the firehouse, they would go paint houses and do other little jobs to kind of get their mind away. But that connection he had with his friend was really wonderful. And of course, with behaviors, social connections, research shows that more likely than not, those patients will be more physically active. They're more apt to use less, risky substances like alcohol and smoking, and also eat better. So, or that's the hope. That's what we teach. So
that connectedness, us to others, us to our environment. I was just as I sat and listened, everything that we do to stay connected is a positive move towards better health overall. Whether you stay socially connected, and we're hearing more and more about that the social aspect of life and your life is something that really promotes better health. And so this connectedness, I'm pretty fascinated. I know, y'all, we could do this for another probably 2 or 3 hours. And unfortunately, we don't have that much time, but I kind of would like to, Dr. Malachi, if there's really final thoughts, 1 or 2 things you'd like to leave firefighters with to remember going forward. I'd like to pose that question to you, and then your final thoughts. And Misha, the same thing. And Misha, if you'd close us out.
I would like to just say to please come to your routine exams, don't miss. Please present any symptoms of concerns that you may have. And don't be afraid to do that, and to speak up if you are having any stress or mental health issues or exhaustion, to please find resources for help for that. And keeping in mind the lifestyle medicine 6 pillars, and that all these things hopefully can help transition away from work mode to hopefully a fun and loving mode that gives a feeling of hope and a feeling of control in their life.
Thank you so much for that. Earlier I mentioned that the KP has been speaking directly with firefighters in California to understand what their cancer prevention and wellness needs are. So we're working to create resources that firefighters can use to support their health when they meet with their doctors. So that's thing one. But another really important thing that President Rice mentioned at the very beginning of the call is that we have a call to action for you, because in addition to the work that we're doing for wellness resources, we also have an active research study that is closing soon. So if you're an active or retired California firefighter and you're a current Kaiser Permanente member, you should have received an email from CPF that's inviting you to participate in the California Firefighter Health Study. We're providing the funding and the research team for this, but the enrollment period is almost over. We need at least 1,000 firefighters to have enrolled to have enough study data to do the research. So if you'd like to participate, please sign up before February 28th. I also want to just assure everyone the study is voluntary. No one's required to participate. Kaiser Permanente is bound by strict research protocols that are for human protection subject research. So please check your email in the fall 2025 issue of the California Professional Firefighter magazine for more information, and use the link to sign up before February 28th. And one more thing, I just want to thank every firefighter who's listening for your service.
Dr. Malachi and Misha, thank you so much. And everybody that's listening, I encourage you. I'm gonna echo what Misha just said. We are doing the California Firefighter Health Study. Our partnership with Kaiser Permanente in this is priceless. And I'll tell you, the only way that we're going to make inroads and lessen our cancer risk and maybe be part of finding the cure for certain cancers is to participate in studies. And the study that we're doing with Kaiser Permanente is very well put together. The research is put together, but we're dependent on one thing and one thing only: the firefighters that are here in the state of California and members of Kaiser Permanente. Even if you've been retired less than 10 years, you can participate in this study. And that was one of the things that Kaiser brought to the table to us. They wanted to capture retirees. So I can't stress it enough. The deadline, the closing period is coming soon. There'll be a link attached here that you can sign up and participate. I want to thank everybody for listening to the CPF Firewire today, and encourage everyone, if you're a Kaiser Permanente member and a California professional firefighter, please sign up for this study. You will be part of finding a cure for cancer, reducing the risks not just of firefighters, but of family members. This is so incredibly important, and our time is running out to have the study group, this group size that we need. We're still about 700 people off. So I'm asking you, as we close out, please get in touch with CPF and our Health and Safety Division, and we will connect you with Kaiser Permanente. We'll make it easy. So thanks, everybody. Dr. Merlache, Misha, thank you guys. Thank you, ladies, so much. I know we're going to do this again because there's just so much to talk about.
Thank you, President Rice.
Thank you, President Rice.